From the Toronto Star, I'm Raji Mudder, and this matters. Optometrists in Ontario and the provincial government are not seeing eye to eye. The doctors are embroiled in a fee dispute that has led them to the extraordinary measure of announcing that they will no longer be accepting patients covered by OHIP starting in September, which will mostly affect people under 18 or over 65. At issue is the cost of an annual eye exam and checkup that those of us with eye and visual issues know is necessary to maintain an accurate prescription and monitor the progress of our sight. Dr. Sheldon Salaba is the president of the Ontario Association of Optometrists and is here to explain their position, why they feel the need to stop serving some patients, and what is at stake. Dr. Salaba, thank you so much for joining us today.
Thank you very much for having me.
Okay, so Dr. Salaba, we're going to be talking about this dispute, but you know what? I want to start with a softball. How important is it for people to go and see their optometrist on an annual or biannual basis?
You know, annual exams are really important. The eyes are the window to the soul. So they give us a lot of information about people's overall health and well-being. And an eye exam performs a lot of essential functions. For children, in lots of cases, it's about ensuring that they're able to see properly so they can learn in school. You know, people with eye diseases, we want to be able to maintain and preserve vision. And that happens with early and frequent diagnosis. And when we get people moving into the senior category, it's really about maintaining healthy, livable lifestyles.
So, Dr. Salaba, right now, your association is in a dispute with the Ontario government. Can you lay out exactly what's happening and why you are upset?
You know, I can give you a little bit of historical perspective. Optometry has no legislative framework that commits the government to working with us around compensation issues. So for the last 32 years, we've been trying to dialogue with successive governments. And, you know, because there's no commitment for them to meet with us, things have just been kicked down the road. Like they've just kept kicking the can. And we've reached a point where we're in a fairly desperate situation because the quality of care that we're trying to provide the OHIP patients that are supposed to be insured by the government is suffering, and we're worried about patient access to it. So that's kind of the root of where this is coming from.
Okay, now I want to be very, very clear about what exactly is happening. Basically, for patients who are covered by OHIP, which I believe are children under 19 and seniors under 65, or that's the majority of them, what you get compensated for that from the government, that cost, or, you know, that hasn't changed in 30 years, basically, right? I believe it was something like $39 in 1989, and in 2021, it's something like $45. Is that right?
That is correct. So there's been very, very minimal investment. And what we've seen over those 30 years is escalation in our costs to provide these services. So we did a study on what it costs to deliver an eye exam about a decade ago, and we're currently in the process of updating those numbers. I've seen my numbers from that already, and it costs me $98 to provide an eye exam to an OHIP patient. And we're only being paid in that $45 range. And when that type of scenario develops, you know, the quality of care that we're delivering to patients suffers. And it means that we're not able to treat people with like the most modern technology. It means that we're having difficulty retaining highly trained staff. So it's something that we really need the government to start dialoguing with us about to address and fix. I'll add that on an annual basis, optometrists across the province provide over 4 million OHIP-insured eye exams annually. So we're providing a substantial amount of service to the public, and it's something that we need the government to pick up the phone and start dialoguing with us about.
Well, I mean, I think one thing I'll say is I'd really like to be able to pay for anything what I paid 30 years ago for it.
Yeah, me too.
Right. I mean, I think pretty much everything else in inflation has gone up in that time. So I can understand where the root of that dispute is. But now here's the thing. You mentioned it before, and I just want to be very, very, very clear about this. Why won't the government negotiate with you? Because really what you really want to happen here is some sort of binding arbitration, right?
Yeah, we're asking for a formal negotiation process, which they afford other healthcare providers like physicians and nurses. But there's nothing that legislatively commits them to doing that with us. And we're looking for that type of equality. We don't want to see any impact to patients having access to care in the fall. And all we need the government to do is pick up the phone and start having a reasonable conversation with us about it.
What would your prescription be for the Ontario government? Would you say they're being nearsighted, farsighted, or blind to what you want?
I think they're being nearsighted and they're likely going a bit blind on the topic because, we are the lowest cost provider to provide eye care services. So I don't understand why they wouldn't be looking to invest in it. Primary care is preventative. We are easily accessible to everybody. Like you can't get in to see a specialist. There's 2,500 of us. So it doesn't make any sense to me whatsoever why they won't look at these services and pay more attention to them.
Now, here is the thing, and I actually think, anybody with young people or older people in their lives with eye issues, this is a really important thing. Your organization has made sort of the extraordinary threat to withdraw taking OHIP-funded patients on September 1st, right? Can you explain that decision and how you came to it?
We have been trying everything to desperately get the government to come to the table and dialogue with us. So in the last 12 months, we've been running an awareness campaign in the background. We have spoken with Minister Elliott in November of 2020. And she committed at that time informally that optometrists shouldn't have to pay for providing service to OHIP patients, like the operating costs of that. The government should be covering it. And we met with the Ministry of Health in December of 2020. And since that point in time, it was one informal meeting. And since that time, we haven't had any communication from them to us since, even though we've been constantly trying to reach out to them. They are very well aware of the issue. We've had over 60 petitions read in the legislature in the last 12 months, which is one of the most read petitions in the last 3 years. We've sent letters to every MPP in March, and I've met with over, I think, 50 to 60 MPPs and cabinet ministers in one-on-one conversations, and they still refuse to dialogue with us.
How does, that cost, that shortfall between what OHIP pays and, what optometrists have to eat, how does that affect you and your businesses? Like, what are you hearing from optometrists? I would assume particularly those that have a majority of OHIP-covered patients.
It really impacts the care that we can deliver to people. It means that under normal circumstances, we would have to see people faster. So that causes their care to suffer. In these circumstances, with COVID, it forces us to have to limit the amount of OHIP insured patients that we can see. So we're really concerned about the quality of care we're able to deliver to people. OHIP patients aren't able to receive the highest standard of eye care that they should be entitled to. And we're really concerned about patients' long-term access. So we're really fighting for our patients with the government to ensure that they're going to have high quality, sustainable care in the future.
We'll be right back. Okay, now, Dr. Salaba, I obviously think that everyone should get fair pay for service, but, I'm going to play a little bit of devil's advocate here. I think that people probably have trouble with the optics of eye doctors who do fairly well to be asking for more money. How do you respond to that?
I think they're misguided. There's a lot of confusion about different types of eye doctors. And, we're the primary care eye doctors. We're not ophthalmologists.
Who are specialists, right?
Ophthalmologists are specialists. And we're the backbone of the eye care system in the province. And we've been completely ignored for 30 years. So the majority of the patients that we see in our offices are covered by OHIP. It's over 70%. And the majority of people are seeking our services for medical eye care. So it's something that has to be invested in order to create a sustainable system for people in the future, because it is at a breaking point right now.
I think the other thing here is, the idea that there are more important or valuable patients, like someone like me who has benefits. How do you respond to a criticism like that?
Well, I mean, we're doctors. It's our duty to make sure that we take care of people to the best of our ability. And we don't want that to be the case. Like if the government says, if they're going to tell people that they cover a service under OHIP, they need to actually pay for that service. I don't know any other healthcare providers, like any type of provider of public services, that are expected to subsidize more of the cost to deliver the service and the government actually pays for.
Do you think that COVID has exasperated your situation? I mean, this is one of these things where obviously people would say that, there's been other pressing matters happening within the healthcare system, which is why you haven't been dealt with.
Not at all. Like this has been going on for 32 years. So I think this is a cultural issue with the Ministry of Health, and it's a problem that needs to be fixed. Like if they want people to have high quality eye care in the province, they need to have reasonable conversations with us, and it can't be have a meeting and then don't talk to them for 6 months. Like, I don't see how anybody could see that as being reasonable. I certainly don't. And I expect more of our elected officials, quite frankly.
You kind of mentioned it before, and it's one of the questions that I wonder, again, whether COVID has exacerbated the situation in the sense that probably previously you could have booked more patients at a time, but now with safety protocols, it has limited the number of patients that can be in an office at a time. Is that a factor in this at all?
Of course, it is a factor because, the amount of patients that we can see is more limited. But, I want to stress that this is not a COVID issue. This is a relationship issue about how the government looks at optometry services and how they are provided. And it's about them not taking any action to have reasonable communication with the service providers that they're paying for public service, like public eye exams for.
What is your advice for patients right now? I mean, I have a 9-year-old daughter, and I'm making sure that she has an appointment before September.
We have a platform, a website called saveeyecare.ca. The biggest help that patients can give us is to go to that website, and they're able to very easily complete a letter that gets sent to their local MPP, Premier Ford, Minister Elliott. And we need the public to reinforce to the politicians that the services that we're providing them are highly important to them. And they need to demand that the government comes to the table and starts having a conversation so there is no impact to their access come the fall. I think if the government understands that this is a critical issue to the public, they will act because they tend to be reactionary to things like this. And that's the biggest help that the public can give us. If you're going into your optometry offices, we also have petitions that we're asking patients to sign, and that's also very beneficial. Letters to editors in local newspapers, very beneficial. So those are the types of things that the public can do to help us fight to maintain high quality, accessible eye care for them.
Has there been any recent reaction from the government, from the people that your counterparts over there, the people that you're trying to talk to?
No, not really. Nobody's picked up the phone from the Ministry of Health to initiate a dialogue with us. There is some communication, quite standardized, coming from MPPs if patients are sending letters to them, but nobody officially from the government or the ministry has reached out to us since December of 2020.
In a perfect world, what do you see as the solution?
Well, I think we're asking for two very reasonable things. We want the government to commit to formal negotiations with us, like they do with other healthcare providers like physicians. They meet with physicians every 4 years, and it's a structured process that is set up on a schedule, and we want the same type of equality. And the second thing is we want them to commit to covering the operating costs to deliver the service. Like, we're not even asking for the optometrist to get paid. We just want our operating costs like rent, salaries, equipment, utilities, insurances, those types of things covered.
Dr. Salaba, this has been really interesting for us. Is there anything that I didn't ask that you think that our listeners should know about this topic?
I think this was pretty comprehensive. I would just say to them that we've given the government a really reasonable amount of time. The government understands the issue. Please reach out. We have until September 1st before there is any impact to patient services. And I'm just really hoping that people will take the time and make the effort to make the government understand that they need to step up and pick up the phone.
Okay. Well, I'm sure we'll probably be following this over the summer. I hope that there is some sort of resolution, speaking as someone who is very nearsighted and everybody in my family. So I hope that this works out in a way that's beneficial for everybody. Dr. Salaba, I really want to thank you for your time today.
Yeah, thank you so much. I appreciate it.
Dr. Sheldon Salaba is an optometrist based in Hamilton and president of the Ontario Association of Optometrists. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Rajin Budler, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.